Welcome to Mastering Section H, Bladder and Bowel on the MDS assessment. In this video, we'll help you identify the various components of Section H, understand the coding guidelines, accurately perform the steps for assessment, discover coding tips directly from the RAI, and recognize the impact of Section H on resident outcomes and developing the resident's plan of care. The intent of the items in this section is to gather information on the use of bowel and bladder appliances, the use of and response to urinary toileting programs, urinary and bowel continence, bowel training programs, and bowel patterns. Each resident who is incontinent or at risk of developing incontinence should be identified, assessed, and provided with individualized treatment and services to achieve or maintain as normal elimination function as possible. Our section begins with item H0100, appliances, where we will examine the resident to note the presence of any urinary or bowel appliances. For this item, review the medical record, including bladder and bowel records, for documentation of current or past use of urinary or bowel appliances, and select each appliance that was used at any time in the past 7 days. These include indwelling catheters, including suprapubic catheters and nephrostomy tubes, external catheters such as female external catheters, condom catheters, external urinary pouches, and other non-invasive urine output management devices. Ostomies, including urostomy, ileostomy, and colostomy. Intermittent catheterization, which includes self-catheterizations that are performed by the resident in the facility, and none of the above. Our next item set found in this section will be H0200A through C, urinary toileting program. Before we jump into these items, it's important to note the specific criteria that is required in order to be considered a toileting program for purposes of completing this section. Toileting programs should have at least 3 days of toileting patterns with prompting to toilet, and recording of these results in a bladder and bowel record or voiding diary is present. The implementation of an individualized, resident-specific toileting program that was based on an assessment of the resident's unique voiding pattern. Evidence that the individualized program was communicated to staff and the resident if appropriate, verbally and through a care plan, flow records, and a written report, and lastly, notations of the resident's response to the toileting program and subsequent evaluations are performed as needed. Our first item relating to this will be H0200A. Has a trial of a toileting program been attempted on admission, entry, re-entry, or since urinary incontinence was noted in this facility? Our steps for assessment will include reviewing the medical record for evidence that a trial of an individualized, resident-centered toileting program has been attempted. Code 0 for no, if for any reason the resident did not undergo a toileting trial. This includes residents who are continent of urine with or without toileting assistance, or who use a permanent catheter or ostomy, as well as residents who prefer not to participate in a trial and skip to urinary continence item. Code 1 for yes, for residents who underwent a trial at least once during the look-back period. Or Code 9 for unable to determine, if records cannot be obtained to determine if a trial toileting program has been attempted. Following will be item H0200B, response to trial toileting program, where we will review the resident's responses as recorded during the toileting trial, noting any change in the number of incontinence episodes or degree of wetness the resident experiences, and coding no improvement, decreased wetness, completely dry or continent, unable to determine, or trial in progress. Lastly, for item H0200C, current toileting program or trial, we will review the medical record for evidence of a toileting program being used to manage incontinence during the current 7-day look-back period, and note the number of days during the look-back period that the toileting program was implemented or carried out. Code no, if a toileting program was used less than 4 days of the 7-day look-back period, or code yes, for residents who are being managed during 4 or more days of the 7-day look-back period, with some type of systematic toileting program. Our next item will be H0300, urinary continence. To assess, we will review the medical record, interview the resident if reliable, family members if not, and ask direct care staff who routinely work with the resident on all shifts about incontinence episodes throughout the 7-day look-back period, and select from the following. Always continent, meaning no episodes of incontinence were noted. Occasionally incontinent, meaning the resident was incontinent for less than 7 episodes. Frequently incontinent, which includes 7 or more episodes of incontinence, but had at least one continent void. Always incontinent, meaning no continent voids were noted. And not rated, which can apply if the resident had an indwelling bladder catheter, condom catheter, ostomy, or no urine output during the 7-day look-back period. Similarly will be item H0400 bowel continence. To assess, we will review the medical record, interview the resident if reliable, or family members if not, and ask direct care staff, who routinely work with the resident on all shifts about incontinence episodes throughout the 7-day look-back period, and select from the following. Always continent, meaning no episodes of incontinence were noted. Occasionally incontinent, meaning the resident was incontinent of stool once. Frequently incontinent, which includes incontinent of bowel more than once, but had at least one continent bowel movement. Always incontinent, meaning no continent bowel movements were noted. And not rated, if the resident had an ostomy or did not have a bowel movement for the entire 7 days, in which the resident should be checked for fecal impaction and evaluated for constipation. Our next portion of the section will focus on bowel management, beginning with H0500 Bowel Toileting Program, where we will review the medical record for evidence of a toileting program being used to manage incontinence during the current 7-day look-back period. Code No. If the resident is not currently on a toileting program targeted specifically at managing bowel continence, or yes, if the resident is currently on a toileting program that is targeted specifically at managing bowel continence. Following will be item H0600 Bowel Patterns. Begin by reviewing the medical record for bowel records or flow sheets, nursing assessments and progress notes, physician history and physical examination to determine if the resident has had problems with constipation during the 7-day look-back period. Constipation is defined as 2 or fewer bowel movements during the 7-day look-back period, or if their stool is hard and difficult for them to pass was experienced for the majority of bowel movements, regardless of frequency. A fecal impaction can be defined as a large mass of dry, hard stool that can develop in the rectum due to chronic constipation. This mass may be so hard that the resident is unable to move it from the rectum. Watery stool from higher in the bowel or irritation from the impaction may move around the mass and leak out, causing soiling, often a sign of a fecal impaction. Now, let's review some popular coding tips and special population guidelines directly from the RAI. For coding appliances such as ostomies, do not code gastrostomies or other feeding ostomies in this section. Also, one-time catheterizations for urine specimen collection or other diagnostic exams, for example measuring post-void residual, during look-back period do not count as intermittent catheterization. Toileting programs may have different names such as habit training, scheduled voiding, bladder rehabilitation, or bladder retraining. A toileting program does not refer to simply tracking continence status, changing pads or wet garments, or random assistance with toileting or hygiene. Toileting programs, including toileting trials, refer to a specific approach that is organized, planned, documented, monitored, and evaluated that is consistent with the nursing home's policies and procedures and current standards of practice. For more information on how to develop a patient-centered toileting program, stay tuned for our next MDS in a Minute video on bowel and bladder management coming soon. Section H plays a pivotal role identifying the resident's needs, monitoring for changes, and developing a plan of care that addresses potential underlying conditions and maximizes our residents' goals, well-being, and safety, which is why coding accuracy is imperative. For more information about coding the MDS, or to see more MDS-related content, follow our channel at MDS Made Easy. Brought to you by the Data Nurse, your partners in MDS Precision.